Money Matters
on Afternoons with Helen Farmer.
With Zurich Life Insurance. Take optimistic action and shape your financial future with Zurich Life Insurance.
Dubai Eye 103.8.
Did you know, you might be one of them, that 8 out of 10 residents here in the UAE is worried about the impact a serious illness such as cancer or a heart attack would have on their savings and income? Today on the show we're discussing the Critical Illness Survey report commissioned by Zurich Middle East and YouGov, who've surveyed responses from more than 500 residents on how they actually would cope logistically, financially, if faced with a critical illness. And joining us now is Dr. Khatchik Kinoyan. He is the Chief Underwriter at Zurich Middle East, sharing some statistics and also helping you understand how you could manage your finances if faced with the unexpected. So do get in touch if you've got any questions, concerns, queries on 4001. Dr. Khatchik, how are you?
Hi, good afternoon, Helen. I'm good, thanks. How are you?
I'm very well, thank you. As I said, already a number of questions trying to understand different types of cover, if that's okay. So we're going to come to the text line after we discuss the survey. But before we even get to the survey, can you explain a little bit about your job? What does an underwriter do?
Well, an underwriter reviews the application for insurance and we decide what kind of, let's say, a rating should be applied, if any, to the particular applicant. So basically it is risk assessment. Anyone who applies for insurance, we review their applications and decide the contracts or decide the terms on which the insurance should be offered to them.
We have had a number of questions asking about people's particular situations, and we're going to try our best to answer those between now and 4 o'clock as well. But let's go to that Critical Illness Survey report. Can you tell us a little bit more about why it was commissioned, Doctor?
Yeah. Well, basically, Helen, if we all have or we all know people who have been diagnosed with either cancer or heart disease or maybe any other chronic disease. So basically, we know that the diagnosis of such critical illness can be devastating. And apart from causing severe emotional distress, such diseases would disrupt all aspects of our lives. So when someone is diagnosed with a critical illness, their lives is not the same anymore again. So you would say a different person. However, knowing all this, we tend to somehow, as individuals, try not to talk about it. Or most of the time we just think that it's not going to happen to us, right? But look at the Zurich's claims data for the 3 years period between 2018 to 2020. We have paid $67 million claims in critical illness. And this is basically 50% of all the claims that we have paid during that period. And it's worth mentioning that the youngest critical illness claimant was 29 years old.
Wow.
So, we think it's not going to happen to us, but it might happen to any one of us at any time. So with this in mind, we really think that people should be more open and more honest and face the facts or the challenges of life and how such kind of diseases will impact their financial well-being.
I think you've touched on a couple of really interesting points there. One being that we're all in denial.
Yes.
We're all thinking that this could happen to other people. But as you say, the amount that you've paid out at Zurich Middle East suggests that that's absolutely not the case. And we all sincerely hope that's not going to be the case. But what you've also touched on there is the impact that it can have on a life and a family. That if someone is in hospital, they're not able to, keep earning. The last thing you want to be doing in that situation when you're trying to process the emotional side is worry about the financial side. And we're going to be talking a little bit more about the survey findings next with Dr. Khatchik joining us from Zurich Middle East.
Money Matters
on Afternoons with Helen Farmer.
With Zurich Life Insurance. Take optimistic action and shape your financial future with Zurich Life Insurance.
Dubai Eye 103.8.
And joining us from Zurich Middle East is Chief Underwriter Dr. Khatchik Kinoyan. He is here to share the insights of a recent survey. And I'm talking about a key study that's been done by Zurich Middle East and YouGov that found that 8 out of 10 residents in the UAE are worried about the impact of a serious illness such as cancer or heart attack could have on their savings and income, a very real concern, but perhaps not one that many actually put into practice of addressing. A question here saying, what's the difference? Would I be covered by the health insurance that an employer provides should the worst happen? Can you explain a little bit about the difference there, Doctor, about health insurance versus critical illness cover, just to really clarify?
Definitely. I mean, in short words, the difference between the health insurance and critical illness is that health insurance pays for the treatment in a hospital or in a clinic, and the payment is made directly to the clinics. So the claimant or the person who is diagnosed with this condition does not receive any money. However, the critical illness provides a lump sum payment to the insured themselves in the case they are diagnosed with any one of the defined critical diseases. Now, why is this very important? Well, let me tell you that when someone gets a critical illness, first of all, their daily cost of living does not disappear. So they still have to pay rent, they still have to pay utility bills and all those expenses that they have. On the contrary, with critical illness, your expenses will increase. You might need to have special professional care. You might need to fly a family member to take care of you, or yourself fly out to receive a better, let's say, support from family. And most importantly, when someone gets a critical illness, they might end up losing their income, which is at one point of time, they will no more be able to work or to earn any income. And with this, they will definitely lose their health insurance. So critical illness, although it does not, ease the pain of being diagnosed with such a disease, however, it provides the means to be prepared for life and to, it gives us more time to reevaluate our priorities and bring our life back together. If we want to change our job, if we want to, start a new type of business or whatever. So we have that flexibility, we have that ability to be financially stable.
And in terms of coverage and the price of the plan, Dr. Khatchik, have you explained a little bit about how this comes together in terms of types of illnesses, morbidity tables? Because presumably, insurance for one person is very different to someone of completely different health and circumstance. How do you put all of it together?
Well, basically, the pricing depends definitely on the type of insurance that someone is applying for. So there are several kinds of critical illnesses in the market with different number of diseases covered, as well as there are, for example, covers that or insurance that covers only cancer instead of having all the other critical illnesses. So based on that particular aspect, which is the number of diseases that are covered, definitely the price will change. Adding to that is the individual's age and their health condition. So if someone starts the plan at a younger age, definitely it will be cheaper.
Okay.
Now, when I say younger age, definitely
nice.
They are healthier. Okay. So it means, again, it will be much more cheaper when they started at an older age where, in our region especially, we know that we have a very high percentage of obesity, diabetes, and so on. So the younger we start the plan, the cheaper and more affordable it would be for us.
So basically what you're saying is all of us, who've been bouncing along through life going, oh, that's something I don't need to worry about just yet. It is hugely beneficial to just get it done as early as possible for the bottom line, as well as you say, that peace of mind. We've had lots of messages for you, Doctor. I'm going to try and get through as many as we can between now and 4 o'clock. Najib saying, thank you for this. How long does it generally take for a claim to come through? I've got a policy with another company, but was diagnosed with a chronic blood cancer October last year. It's hopefully treatable. I've submitted the paperwork mid-November and it's all gone quiet. I've just been told it will take some time for assessors to look to see if they've got enough information. Can you give an indication of timeline? Thank you. That's from Najib. And as he says, that's from a different company and you can't speak to the specific case. But what is the kind of general turnaround time, or is it very hard to say?
I mean, look, if we do have all the necessary documentation, which is the reports and all the other supportive documents like the passport copy or whatever, because, there are lots of anti-money laundering and all those reviews to be done. it shouldn't take more than 3 to 7 working days.
Okay, right. Najib, you need to get on the phone. Right. Okay, we're talking with Zurich Middle East this afternoon. And as I said, lots of messages coming in for Dr. Khatchik Kinoyan, Chief Underwriter at Zurich Middle East.
Money Matters
On afternoons with Helen Farmer.
with Zurich Life Insurance. Take optimistic action and shape your financial future with Zurich Life Insurance.
Dubai Eye 103.8.
And joining us from Zurich Middle East is Dr. Khatchik Kinoyan. He is a chief underwriter. He's sharing some statistics around this region and helping us understand how you can manage your finances if you are faced with the unexpected. Zoe's been in touch saying, thank you for this, very timely. But when I was back in the UK, I wanted to update my life insurance policy and add critical illness cover to it, but I was declined because I suffered from postnatal depression after the birth of my first baby. Can you advise how mental health is considered here? Thanks for that, Zoe, and I hope you're doing well. Can you speak to that, please, Doctor?
I mean, definitely any kind of health condition, whether it is mental health or physical health, is looked into in a separate way for each individual. So there's no general criteria or general rule that applies to any kind of disease. Rather, it's the individual case by case that are being reviewed. Basically, what happens is, of course, the degree of the severity of the disease, as well as the time from the date of diagnosis, as well as the current condition, they are all taken into consideration when assessing the possibility of offering cover to any applicant. So we have cases where mental health is covered for life benefit, I would say. However, different benefits will have, again, different kind of approach or different decisions regarding this particular kind of condition.
Definitely worth a conversation. Postnatal depression is an interesting one because I don't know how you are now, Zoe, but for many people, myself included, it was fleeting and it was medicated and then it was absolutely fine. So I think it's a bit of a tricky one, but definitely worth a conversation. Miriam's been in touch saying, do you recommend life insurance for children and can they be added to my policy? Is that a common request, and what would you say to Miriam?
I mean, we have from the Zurich claims data, I could share with you that we have paid a claim for an 11-year-old child for a critical illness. So definitely having insurance or insuring children is something essential. However, it depends on the person and what kind of protection they want to offer their child. So there are different kinds of protection, different kinds of benefit. So I would recommend that they consult with their financial advisor to see what is best suitable for them as a family and for their child.
Coming back to critical illness cover for adults, but perhaps bringing in the child aspect as well. And my goodness, we all hope and pray that our child is never diagnosed with something that would lead to, it disrupting your life, having to stop work, for example, for caring for them. But is there any insurance out there that perhaps would help you in that circumstance?
Well, we do offer critical illness cover for children together with the critical illness for the adults. So a person buys critical illness insurance for themselves, then automatically they are granted critical illness insurance for 3 of their children.
Oh, wow. Okay.
So whenever there is any claim, definitely the amounts are less than the amount of the insurance for the adult. Mm-hmm. However, there's a portion of money that will be paid if the child is diagnosed with a critical illness.
Okay. We've got one here on 4001 that's anonymous saying, I know this might be a stupid question, but if you're getting life insurance for your mortgage, do you have to get it on the same day you buy your house? Is there a rule that you have to get it when you buy it, or can you get it after? I don't think that's no such thing as a stupid question in my book, but a good question about the timing then, because I had to get a life insurance when I bought a property back in the UK, and made me feel very grown up indeed. But in terms of the timing, when do you advise that policy starts if you're getting it for a mortgage purpose, please, Dr. Khatchik?
I mean, different banks have different approaches. From our perspective, the mortgage has to start from the insurance has to start from the date of the mortgage, because many banks will not even release your mortgage unless you have insurance protection to cover it. So definitely it has to be starting together with the mortgage.
Okay, there you go. Hope that helps.
Money Matters
On Afternoons with Helen Farmer.
with Zurich Life Insurance. Take optimistic action and shape your financial future with Zurich Life Insurance.
Dubai Eye 103.8.
And joining us from Zurich Middle East to talk about some statistics in the region and answer your questions too is Dr. Khatchik Kinoyan. He is a chief underwriter and talking really about how to manage your finances if you're faced with the unexpected. We're encouraging you to think about your future self and take some action today. No name on this message, Doctor, and as I said, it's absolutely fine to be anonymous, saying, I'm in my 50s and healthy, but want some sort of financial protection in case I get a serious illness that will affect my income. I've got 2 children. I've had 2 quotes with similar monthly premiums, but one pays out a monthly amount for a year, critical illness cover, that would cover all my ongoings, while the other pays out a lump sum that would also cover my outgoings, income protection. 2 companies vying for my business. It feels like a big decision, but I've got a niggling feeling I'm missing something here. This is your bread and butter. What would you advise in terms of, I guess, the practical side of 2 different policies in this situation?
I mean, there's always different kind of offers available in the market. And I'm sure that at his age, he might be able to find even more options or more offers. However, at the end of the day, it's up to them to look into what is more relevant to their financial needs and accordingly decide what kind of product they would want to apply for. In some cases, they might need the help of their financial advisors. Even it could be that their company's, financial manager or something. But definitely the need for a critical illness is there. And it's up to the person's prioritization and what they want to achieve with their financial security. They have to decide which plan they can take.
And a question here from Oscar on life insurance, saying, I've got a 1-year-old son, so keen to get life insurance, but I've got no idea what I'm looking for. Can I have some examples of things that I would want and would be useful? It's funny, isn't it? There does tend to be these big life events like buying a house or having a child that prompts you to start really taking care of yourself and your family. So for Oscar and his young family, what are some of the things that you'd be looking for in a life insurance policy, please?
I mean, first of all, in case of premature death, there is a really great financial loss to the family. So definitely there's a need for life insurance to secure their financial needs in case of something unexpected happens to the breadwinner. Secondly, I mean, there's always the future of this child, their education, their college. So do we have enough saving to make sure that this child will have the finances to be able to attend these colleges? So definitely all kind of insurance can be looked into when a person has a family, especially with young children, where their financial security is very important.
Doctor, thank you so much for your time this afternoon. Been really, really helpful for lots of us. Even if it's just been a message that, not message specific, even if it's just been raising the topic and talking about it and leading us to think a little bit more about how we can be protecting our families, ourselves, our finances, as you say. And all this can be found on Zurich Middle East website. Thank you so much for your time. Wishing you a wonderful afternoon ahead and hopefully talk to you very soon. Thank you so, so much.
Thank you, Ellen.
This is Afternoons with Helen Farmer
Join the conversation
on Dubai Eye 103.8.